I am Dr. Malia Jones. I'm a social infectious disease epidemiologist, nerd, and the former editor-in-chief here at Dear Pandemic, and I am super excited to be back with you. I'm thrilled to share that we are relaunching our live Q&As after a 6-month hiatus. Thanks very much to Dr. Chana Davis, who is here with me today, and she's going to be taking over as the lead host of our live Q&As. Dr. Davis is a geneticist and a super nerd, and she's going to be carrying the Q&As forward from here. So take it away, Chana.
Thanks so much, Malia. It's a pleasure to be here. I'm thrilled to be hosting this forum. I view this as a space to dig a little bit deeper and to share some of our personal perspectives about how nerds like Malia and I actually tackle these decisions that are very relevant to our lives. And as a reminder, we don't take questions cold. The questions that we'll be discussing come from our inbox, and we want to make sure that we have all the resources and links ready for you. You can always submit to our inbox, and we'll include them in the questions that we survey to decide what we're going to tackle on any given Q&A session. And I guess that's all I want to say for intro. So let's just get started because we have a lot we're going to be covering today, from variants to boosters to rapid testing and vaccines for kids.
Yeah, there was a lot to pick from because it's been so long. So I want to start off with this question because I know it is really relevant to you. Jennifer in Texas asks, we had the Omicron variant and we were vaccinated. Do we still have to worry?
Yes, this question is definitely up my alley. That is exactly the situation my family is in. So my husband and I are fully boosted. My kids have had 2 shots, and we all had Omicron. So my son had it right on Christmas Day, and the rest of us managed to escape, but then we all got it 3 weeks later. So this is something I've, thought about a lot. And, initially I was a little bit worried when BA2 started to emerge, but based on what we know now about quite small risk of reinfection, I feel like we are in a low risk category right now. So we have what's called hybrid immunity, which means we have immunity both from vaccines and from natural infection. And importantly, that our natural infection comes from a relevant variant. In addition, our immunity from both of those sources is relatively fresh. So because we're in that situation, I'm not particularly worried about reinfection at that time, at this moment. But I know that immunity both from vaccines and from natural infection is sort of unpredictable in how long it's going to last. And so my level of worry is going to slowly ratchet up over time. Since this question comes up a lot about what's the risk of reinfection with BA2 after having BA1, I'll say that there was a study that they looked at almost 2 million infections and looked for reinfections. And they found about 1,800 reinfections in that population of 1.8 million. So that's about 1 in 1,000 reinfection risk.
And that was reinfections within a short time window, right? So that was within a couple months.
Reinfections within a 2-month window. Thank you. Yeah. And of those reinfections, only 47 were BA1 followed by BA2.
Right.
So a majority of the infections were Delta followed by BA2 or another Omicron. And those reinfections often happened in young and unvaccinated individuals. So as a vaccinated individual, your risk is presumably lower. Now, this was not like a randomized controlled trial. So you've got to take those exact numbers with a grain of salt. But just in general, we're not seeing a huge amount of reinfection following BA1.
Right. Yeah. So I will put the link to that study in the chat here.
Okay. I thought one more thing I wanted to add here is that, as I mentioned, it's really important when you're considering your reinfection risk to consider what variant you previously had. Now, most of us don't know what variant we had for sure, but you can try to guess based on just the variant landscape at the time you were infected. So at some points in time, it's almost 100% of a single variant. And other times it's more of a 50-50 split. And so I actually, being a super nerd, of course, I had to find my local public health dashboard. And here in BC, there is a dashboard. They report weekly what the variant distribution is. So you can go back and look. They reported about 2 weeks after the time. So you go back and comb through all the reports and say, what was the variant landscape at the time that I was infected? And that just gives you a rough sense of probability. So in my case, when my son was infected at Christmas here in BC, it was between 90 and 95% Omicron. So it's very likely he had Omicron. By the time we were infected, it was over 95% Omicron. So it's pretty safe to say that we had Omicron, but you would have to check your regional dashboard to get a sense of what you had. I know that in the US, there is a national tracker that also gives some regional breakdowns. And I have a link for that. If anyone's interested, check out the variant proportions in the US.
Yeah. Yeah. So as we see the new BA2 variant start to sweep in the United States, hopefully, all those people who had Omicron 1 will not be at high risk for reinfection.
Mm-hmm. Exactly.
Great. Well, thanks for that.
Have we got those links dropped?
Sorry, I think so. Yeah. I don't see anything in the chat here, so I don't know if somebody can wave to us, say hi, tell me it's working. That would be great. Oh yeah, it is working.
Are we good?
Yeah, good.
Okay, excellent. So may I ask you a question now, Malia?
Of course.
This is one of our hot topics. So what on earth is going on with fourth shots or second boosters?
Yeah.
Should I get one? So this is a question from Jazine and Alameda and many other readers.
Yeah. So this second booster situation is it's a little messy. You should really see the back channeling we've been doing within Dear Pandemic as we've tried to figure out how to explain this clearly, because there is actually a lot of lack of clarity here, both in the messaging and in what we know. And I think we may have even broken one of our newer contributors, Dr. Madsen. She wrote a post about this on Thursday, and it was really rough going. But she did, in the end, I think, write a lovely post. Her big takeaway from it was the higher your risk of severe illness, if you got COVID, was the more you may benefit from getting another booster right now. And I think it's also really important to note at the top that there are really, I think, very few downsides to getting another booster now. And I will talk a little bit more about this. I like this way of framing it because it highlights that it's not a clear-cut answer. It's not like, yes, this exact group of people needs another booster. We don't actually know that right now, what group of people need it the most. But I think, thinking about it as a spectrum and thinking about your spectrum of risk and where you are on a spectrum of risk is helpful. So first, let me back up a little bit. I just want to make sure everybody's on the same page. What we're talking about here is people who have had 2 doses of an mRNA vaccine originally, that's Moderna or Pfizer, and then got a booster dose, and it's been 4 or more months since the booster dose. CDC recently authorized a second booster dose, so that's shot number 4 for all people who are age 50 and older and people who are younger than that and are immunocompromised. And we're getting just a lot of questions about do I really need this? What is the evidence here? So FDA and CDC, when they authorized this, they reviewed data from a couple of studies that came out of Israel where some people have been getting a 4th shot. Honestly, those data are not very clear, I think. From my read, who really benefits the most from another booster is unknown. One study showed a really pretty modest reduction in symptomatic Omicron cases in a sample of healthcare workers, but there was no difference in symptomatic or in severe disease between the control group and the group that got another booster. And then another Israel study looked at 4th boosters in people who were between ages 60 and 100. And they did find a reduced risk of death from COVID in people who got boosters, but it wasn't randomized. So it's tough to make really strong conclusions about, maybe it was actually lower risk people who got a 4th booster for some reason. So, who needs it the most, I think, is unclear. What are the benefits of a 4th dose? Well, your potential benefit is going to be higher the higher your risk from a COVID-19 infection is. And what we do know here is that the potential harm of taking another booster dose is really quite small. They are safe. There were no safety issues raised. Several million people in Israel have gotten a 4th dose, and side effects were similar to the first booster. So overall, to kind of put a bow on it. As I see it, there are very few downsides of getting one if you're eligible. And personally, from an epi perspective, I would rather, since we don't know who really needs one, I would rather cast a wider net and be sure to capture the people who really need one, since the risks are so low, right? It's sort of like, why not? However, I will say not everyone agrees with this. The EU regulators, for example, are not recommending a fourth dose right now, and they're citing that there's no evidence that immunity is waning. And so there's some, it's up in the air. Do you know what it is in Canada?
I think it's actually not far behind the US. There was actually a
Okay.
woman at the pharmacy yesterday saying, do you know when the 50, I heard it's going to be over 50 now. Do you know when I can get mine? And I
Yeah.
said, well, we don't have supply yet. So I think we're kind of just one stage behind you in terms of highest risk first and then opening up the
Right.
risk levels.
So I think right now there is enough info from those Israeli studies to suggest that people who are at higher risk for death from COVID-19 should get one. It's definitely safe and it might be helpful. And, as always, I would say just talk to your clinician or your pharmacist if you're in doubt about this. And I'm going to put a link to Dr. Madsen's post about this just yesterday, I think this was.
Mhm.
We're working on another one for next week that's going to be a more in-depth review of what we know, or more accurately, what we don't know about this. So
Yeah.
you can watch for that in terms of the epi. And then the last thing I want to say before I quit talking about this is that if you haven't got your first booster yet, there is very strong evidence at this point that for your first booster is very important. So if you haven't got the first booster yet, go and get it.
Yeah. I think a lot of the studies looking at the fourth dose are trying to hammer home the point that they're usually comparing fourth dose against those who had a third dose already. So they already
Right.
have considerable protection. And that's a higher bar than.
Yes, it is a
people who
much
had
higher
just the
bar.
two doses.
Exactly. That's a good point.
But just to unpack a little bit what you said, that we don't know who benefits most. I think we do know that those who are at a higher risk of severe COVID outcomes benefit more, but maybe we don't know at an individual level what your specific immunity is.
Yes, exactly. Yeah, almost no one knows what their own levels of antibodies are. And actually, I don't think it's possible to know what your personal immunity is, because immunity is not just your antibodies. It's also what you're exposed to, what the variant is, how much virus you're exposed to, for how long, if you're fighting another disease at the same time. There's a lot to immunity. And so I don't think it's really possible for any of us to know what our own immunity level is. And so, yeah, at the epidemiological level, it's clear that higher risk people, at least some of them, are going to benefit from another dose. But we haven't been able to get real specific. And I don't think it's possible for like you or me or any other one person out there to really know for sure, like, do I personally need this?
Yeah. Well, I think an antibody response is one metric, but it doesn't stop the whole picture in your immune protection level.
Exactly.
Yeah. So building on this, what's going on with J&J in terms of boosters and just in general protection?
Yeah. So we are, I've been following this question a lot because, as you know, I had J&J, so I've been tracking this. As new information has emerged about J&J, it has become more and more clear that the mRNA, the 2-dose vaccines, do offer better protection than J&J does. J&J is not a total failure. It offers pretty good protection, but it could be better, right? J&J recipients definitely do need a booster. So there's really no question about that. And, just to cite some data on this, one US study during Omicron found that deaths from COVID-19 among people who were unvaccinated were 10 times higher than among people who got Pfizer or Moderna. And deaths among J&J recipients were 4 times higher than among Pfizer and Moderna recipients. So it's not as bad as having no vaccine, for sure. It could be better. There's also some good new evidence that getting an mRNA vaccine booster for your J&J shot can basically bring you up to speed, up to the same level of protection as people who got 2 doses of mRNA in the first place. So the recommendation is to get an mRNA booster for your J&J vaccine. And if you already got 2 J&J vaccines, you're now eligible in the United States for an mRNA booster. So it's a little complex. I wrote out all the different scenarios in a post about this week. So I will drop that link in the chat right here.
Okay. And if we're ready for one more, I know.
Yeah, sure. I know there's tons of
Okay.
booster. There's a couple in the chat too that I think are ones that we plan to address. So yeah,
Okay.
let's do them.
Let's talk about boosters and kids, or just what we know at this point.
Yep. Boosters and kids. So what is going on with these? Caitlin, let me see if this works. Oh yeah, Caitlin asks us, does anyone know when boosters will be recommended for kids aged 5 to 11? So my kids are in this age group. I am wondering too. Unfortunately, we just don't have much to report. Kids who are age 12 and up can get a booster, including the ones who turned 12 since they got their first 2 shots. So if your kid was 11 and they've since turned 12, they can get a booster. Also, immunocompromised kids who are ages 5 to 11 can get a Pfizer booster once it's been 5 months since their second dose. For the rest of us, for the rest of the 5 to 11s, we're just waiting for news. The vaccine was authorized for kids in this age group on October 29th in the United States. It will be 5 months from my kids' second shots on April 30th. So I'm just crossing my fingers that they authorize boosters for this group soon. And yeah, we'll let you know as soon as we hear anything.
Yeah. One other question related to boosters that comes up a lot is, what about sort of timing the market? You know, if you have a big European summer vacation, is that a bad idea to be boosting now and being less protected in, 3-4 months? Potentially?
Yes. So this is a really hard question to answer because we can't tell the future, right? It's very hard to know what's coming next. We don't know what's coming in the fall. We think maybe this is going to turn into a seasonal kind of a thing. There may be a wave in the fall. We don't really know if there will be a new variant before then. There could be a new formulation of the vaccines before then that's a variant specific. And we also don't know how long your immunity boost would last from a 4th shot. So I will say this, don't put it off because you think it might be your last COVID shot. I don't think it will be. We don't know when variant specific boosters are coming, but we probably will have them. The FDA met yesterday to talk about this and how to plan for the selection of variants and roll out variant specific booster shots like we have for influenza every year. When those are ready to roll, I would guess that everyone will be eligible for variant specific boosters, including people who get a 4th booster now. And, it even seems like we could end up with a combo flu COVID vaccine ultimately that would be annual. So, I don't think there's not like a future where you're missing a future booster if you take one now. I don't think that's the case. Timing it to, protect you during your big trip to Italy, that's harder to say. I don't know. Hard to guess where the market is going, right?
Mm-hmm. Yeah. Well, thanks we got to get you a crystal ball because I know we ask you a lot of these.
Well, I have my magic 8 ball right here. So but you have to phrase it as a yes or no question.
Okay. As a last resort, we'll bust that out.
All right. So I've got one for you next. Wait a minute. This is question 3. Question 2. Here we go. The new Omicron strain. How worried are we?
Okay. Well, that one, as usual, is going to depend on kind of who's asking the question and what the situation is. But let me give a little background first. So BA1 versus BA2. So I hope a lot of you have heard or read by now that these are 2 subvariants of Omicron. So they're both in the Omicron family. You can kind of think of them as siblings. They share around 30 mutations relative to the original strain. And BA2 has 8 unique mutations that are not found in BA1. And BA1 has 13 mutations not found in BA2. So it's like they're overlapping. They have some similarities, but they also have unique differences. And it's BA1 and versions of BA1 that were largely responsible for the winter surge in much of the world. And now BA2 is taken over and is the dominant strain in many of the places that already had BA1. So it's officially taken over in the US, in Canada, parts of Europe and Asia are now dominated by BA2 version of Omicron. So in terms of what we know about BA2 versus BA1, I think the big difference is transmissibility that people are talking about. It's quite clear that it's even more easy to spread to others. we don't see obvious differences in disease severity, at least between the two Omicrons. So bringing it to the question of worry, personally, I'm not too worried about BA2, as I mentioned earlier, because my family and I all have fairly fresh hybrid immunity. None of us are immunocompromised. So it's a reasonable assumption that we are well protected against BA2 for the time being. But if I hadn't had Omicron relatively recently and I didn't have hybrid immunity, I would definitely be worried. The risk of BA2 is high in a lot of places, even if the case counts might not look high. Case counts are not really that reliable anymore in much of the world. It's like the US where people are testing at home. It's not being reported. So I just, where I am right now, I would assume that there's a lot of, potential risk of BA2 circulating in my community in many places in the world. So again, if I hadn't had Omicron and the vaccine, I would consider myself at risk of infection.
Yeah,
and,
we just, for
go ahead.
a little color, we somehow managed to not get Omicron. And I'm still wearing a mask everywhere because I agree with you. I think my risk of getting one of the Omicrons is still quite high.
Yeah. And, people keep learning all over again that mild does not mean a cakewalk. And I just had a friend posting on Facebook the other day. It's like, why do people keep calling this mild? I just got it and I feel horrible. I haven't felt this bad in 20 years. He's not in the hospital, but he's still not enjoying himself and kind of wishing that this weren't happening. And of course, what I worried about most is actually the long-term effects. And so I feel a great sense of relief that we haven't had long-term effects in my family, but it is remarkably common how even a mild case can end up with longer term, whether it's fatigue, brain fog, other mysterious things like tachycardia, heart rate, arrhythmia. There's so many symptoms that linger for a reasonable proportion of the population in the long term. And there's a science communicator called Raven, the science maven, that I like, that just put out a YouTube video describing her experience. And, she was my age group, healthy, and is very much really life has been affected in a big way by this and several months later. So,
and now that it's been 2 years, sorry to interrupt you. I was just going to say, now that it's been 2 years, we've had time to see what kind of other chronic illnesses are higher in COVID survivors. And there actually are some pretty scary effects on heart disease rates, stroke risk, cognitive decline. There's quite a bit going on with people who, got COVID and recovered and then have higher risk of a lot of other stuff.
Yeah. So if I'm not a big fan of the get it over with kind of mindset, that even though having had it, I have to admit it's a huge relief. It's like, well, it's a relief partly because I was anxious about how bad is it going to be when we get it, because it's such a wild card, right? I mean, most likely it'll be mild, but
right.
My whole family experienced a spectrum of severity. So it is kind of relief when you went through it. Although sometimes when you get through it, you're feeling really horrible and kind of looking back at what you could have done differently.
Yeah.
So, but just stepping back in terms of, I think there's probably also an implied question here about, is there going to be a surge? Is there going to be lockdowns? And all of that just depends. Impossible. Surges are impossible to predict because we've learned that over and over again. And B, the public health response varies a lot from country to country. One country may have a surge and the government doesn't respond with the lockdown. Another may have a surge and they do respond. So that's really hard to predict, and that varies regionally. But it is interesting, and I think there's a lot of people perplexed by why we're not seeing a huge surge in the U.S. with BA2, and yet we are seeing that and seeing upticks in hospitalizations in other parts of the world.
Yeah, and particularly the UK is it's really, really a mess over there with BA2, even though it was also a mess with BA1. So
yeah, exactly. So just in terms of we're just really speculating in terms of how it's going to happen, but some of the factors that matter are, what's the immunity of the population, both what's their exposure to BA1 and protection, like people are talking about an immunity wall that the US may have from all their Omicron cases. And then there's the vaccination, especially in vulnerable people, that makes a huge impact on how the mortality plays out. And there's some pretty striking graphs. It was in the Financial Times showing, New Zealand versus Hong Kong, where in Hong Kong, a lot of the elderly population has a lower vaccination rate, and the mortality rate from Omicron is really quite staggering. but for a same number of cases, playing out very differently in the healthcare system in New Zealand with a high vaccination rate, especially in vulnerable populations versus Hong Kong.
Right.
So there is some concern in the U.S. that the adults are not as boosted as we would like them to be, to sort of say that if we do get a big surge, the mortality won't be as big as it could be. That's the discussion around that.
Yeah, and I have no special insight into FDA's process for approving that fourth booster, but my guess is that that's what's that's kind of what's going on here. Is like, let's get that most vulnerable population as covered as we can get them, and at least avoid the worst of another surge when it does come.
Yeah. So unfortunately, I don't have a crystal ball either, but so the answer is going to vary a lot regionally, and based on your personal situation and risk profile.
Yeah. So I put the link in here to a article in the conversation that's about BA2 and how worried we are. But since we're talking about variants, I've got another one for you about variants. And this, I know this is Chana's specialty. She just loves these testing questions. Thank goodness, because I don't know if anyone else does. So the question is, do rapid tests detect Omicron, and what about other variants? And this is a question from John in Pennsylvania.
Okay, yes, I do love rapid testing questions. I used to work in the diagnostics field, so I get excited when I get to go back to my home turf. So the short answer is yes, the rapid tests do detect variants, but their performance has to be reevaluated with every variant because the performance is not identical. So they in general, they work, but there are subtle differences. And the important difference is what we've usually been seeing with different variants is that it's sensitivity that takes a hit. So that means there's a higher risk of a false negative. In other words, there's a higher risk that you take the test, you actually have it, but the test is negative. So we just have to, it's really important to bear in mind that, again, they work, but they can also miss it. And the best way to protect against that is to do repeat tests. So never assume that one rapid test is all you need and that's your definitive answer. You need to test repeatedly, ideally daily from, let's say, 3 days after exposure for maybe another 4 days. Exposure or symptoms, you want to test for another 3-4 days after that. And there will be some cases where it actually never turns positive. Even people who have symptoms and it's just like, it's a smoking gun. It's like, they must have it. Why are they not testing positive? That does happen. It's not super common. Like in my family, everyone tested positive, all 5 of us. And we were very stereotypical cases. And then, my other friend didn't test positive for the first 4 days. Then she was positive on day 6. It's like it's hard to predict. In general, they're catching maybe half to 3/4 of the cases in the expected time window, but there's going to be those random ones that don't test positive. So you kind of have to consider the big picture of like a family member right now. It's like they knew they had an exposure. They had a fever 3 days later. The test is negative. Well, I think it's a test. I think that's probably a false negative. And in fact, I think it was my brother and I had a wager with him. But so I was so annoyed, by the way, with the rapid test because they kept turning negative. I was like, I'm betting you anything she will be positive tomorrow or the next day. And so we made a wager and she did not turn positive. But then her sister turned positive and the mom turned positive. I'm like, well, it's very obvious that she got it and she gave it to her sister and her mom, but she's not testing positive. So again, that does happen.
Didn't you have a name? Like, wasn't there some kind of a shorthand for this?
I think we call them the untestables or something.
The untestables, right? Yeah. Or the undetectables or something like that. Yeah.
Undetectables. That's a good one. Yeah, that was the name. So there are these mysterious undetectable cases, which is probably a case of, for whatever reason, the virus isn't localizing very much in their nose.
Right.
They did a couple of throat swabs with her too, but the virus is not just in your nose. That's just where the readout is coming from.
Right.
So it's all contingent on how much virus is on that swab. And timing is a big factor because the viral load starts high, then it goes up, and then it goes down again. But also just the sampling, right? And since as you've alluded to, I love nerding out about this. I'll just explain a bit like how this works. And so a rapid test is really like a 3D physical interaction. And I like between your test is kind of looking for something that fits perfectly in that pocket, the viral protein. And think about it like a Cinderella slipper. It has to fit perfectly to light up. But if it doesn't fit quite right, like stepsister's like wedging her foot in there, you could kind of get it in there if it's not exactly the right fit. And so the key question when you're talking about variants, so these tests were all designed for the original strain. And if the variant has a slightly altered, foot going in that shoe, it kind of depends on exactly how the foot is altered. And in the case of the Omicron variant, the protein you're detecting, in most cases, it's called the nucleocapsid protein. So it's funny because people are always talking about how many spike protein mutations, but I care about nucleocapsid protein mutations because the nucleocapsid protein is the one that is used in rapid tests, usually, not the spike
That's what
protein.
the rapid tests are detecting, yeah.
Yeah. So I'm always looking at, well, how many mutations are in the protein that they're looking at in the rapid test? And so for the original Omicron BA1 strain, it was 4 mutations different than the original in that detected protein. And the BA2 is 5 mutations different. But it depends a lot where exactly those mutations are. And what you see is that since every test has a slightly different kind of glass slipper, it depends on the brand. And so I actually recommend trying more than one brand because it takes so long to do all the really rigorous testing to know the exact performance of each brand that you might as well just try more than one brand because then the chances that you miss it are lower if you have that possibility. Anyways.
Yeah. Fascinating. Do you know if they're working on updating the tests for new variants as well, or?
Yeah.
I know we don't ask questions cold. That was a cold question.
Yeah. I feel like it's such a moving target. Like if we knew we had one that was gonna be around for a long time, maybe I don't know if it would be worth it, given that it's sort of good enough and you can kind of get over it by testing more than once.
Right. Yeah, what we've been doing in my family is we have several different brands of tests laying around, and just because we buy what's available, and then, when we've gotten a cold, we all get it, right? So I just test all 4 of us, and then I have 4 different tests that does reduce your chances of ending up with, a false negative for one.
Exactly.
Right? So if we had 3 positives and a negative, I would assume that everyone had the same thing.
Exactly. I think one thing you can do is kind of design a more generalized one, just like you can design like a generalized vaccine against multiple different versions. So maybe they would make they wouldn't make one Omicron specific, but maybe more generalizable.
Right. Make that slipper a little bit more of a universal fit.
Squishy material. Yeah. Universal fit. I like it. Yeah. So let's, I think we're moving on to closing out here.
Oh, yes.
The topic that all the parents of little ones are wondering about, what the heck is going on with vaccines for kids under 5?
Oh my God, right? So what the heck? Well, unfortunately, we don't have much new to report today, but I'm going to give you the latest update because I know everybody is wondering about this. There are 2 vaccines on the horizon for kids who are younger than age 5, and those are from Pfizer and Moderna. I'm talking about in the United States. In other places, actually, there are some other vaccines that are being used in younger age groups. So in the US, let's talk about Pfizer first. So what happened with Pfizer, they fielded a trial of a vaccine for kids who are ages 6 months through 4 years. And that dose, it was 1/10 of the adult dose. So it was and the adult dose is already a very tiny amount of medication. So it's a really, really small dose. Unfortunately, they announced in December that their results were disappointing. It did not generate the antibody response that they were hoping for. So they went back to their study volunteers with a 3rd dose to see if that would bring the antibodies up to where we think they'd be protective. Then in February, the FDA made this really surprising move. They asked Pfizer to submit an application for an emergency use authorization anyway, without the results of that 3rd dose. And many vaccine experts, including me, thought this was not likely to go very well, considering there's at least one member of the FDA who has pushed back pretty hard on the whole idea of kids' vaccines. I didn't see how is a vaccine that can't prove any potential benefit going to be authorized? And then, if it did go through, would people want to get it? This is a vaccine uptake for kids is horrible already. I just couldn't see how we were going to message a vaccine that hasn't even been shown to work, right? So maybe somebody at the FDA had the same concerns, or maybe they actually saw the data and realized it really wasn't borderline. It was not good enough or something. We don't know. A week later, FDA canceled that meeting. They did a total 180. They canceled the meeting to review the data without the 3rd dose. So now we're back to where we were in December with Pfizer. We're waiting for them to finish up that trial with the third dose of vaccine and see if it worked. Pfizer and the FDA have both said that they expect those data to be complete in early April, which it is early April right now. So hopefully it's going to be any day now that we hear whether this third dose with the Pfizer vaccine worked. We'll just have to wait and see. And if they do move forward with it, go ahead.
Go ahead. I just want to emphasize again, I think it's just easy to assume it's a safety issue whenever things don't move forward, but just, yeah.
There was no sign at any point of a safety issue. It was really about the potential benefit and getting the antibody levels up. And really interestingly, the antibody levels were okay for the 6-month through 23-month participants, but too low for the 2-year-olds to 4-year-olds. So like nobody's explained that yet. We haven't seen the full data yet because it hasn't been submitted to the FDA. So we're waiting for that. If they do move forward, it will be a 3-dose vaccine, and it'll take some months before it is reviewed by FDA and comes to market. But yeah, it's a great point, Chana. There never has been any safety issue. In fact, the kids in the trial they reported did great. So, okay, so that's Pfizer. I'm going to drop a link to the Pfizer stuff there. Moderna. All right, so 2 weeks ago, Moderna reported in a press release that their kids' vaccine trial produced very good immune response and safety for their vaccine for kids ages 6 months through 5 years. Their vaccine, the dose was a quarter of what adults receive, and it's 2 doses, 28 days apart. And they said 2 weeks ago that they are moving forward with an application for their vaccine to regulatory bodies around the world, including here in the US. And as a side note, they are also applying for authorization at the same time for their kids' vaccine for ages 6 through 17 in the US. Those age groups are actually already approved in some other places around the world. So I think it's no surprise, just as an aside, that these two companies ended up in different places. In terms of their kids' vaccine, they took really different approaches to the study design for testing a kids' vaccine that required different timelines. So they started off on quite different timelines. Pfizer used an age-tiered design that allowed them to roll out consecutive and apply for consecutive age group vaccines faster. And that worked for the 5 to 11 group. But it backfired for this younger group because they didn't see the results that they wanted. Moderna took more time at the outset to dial in the dose and for all the age groups at once. And so that's why we are going to end up seeing the Moderna vaccine for ages 6 months through age 17 all at once, where Pfizer is doing it sort of in a staggered approach. Okay, so when? Everybody just wants to know when. Summer, we're hoping early summer. Moderna has estimated that if all goes well with their review at the FDA, that they could be hitting the market in early summer. So, all we have so far is a press release. FDA has not met about this yet. What they reported in the press release looked really promising. So I am hopeful that Moderna will become available for kids. And we're just going to have to wait and see on Pfizer.
All right. Thank you for the update.
Yeah.
It's so hard for families with young kids. My youngest are 6, and they turned 6 recently. So they were just made the cut for not being in that limbo land for so long.
Yeah, for sure. I know people are feeling like their kids are just going to age into the vaccine at some point.
Yeah.
I have a couple of quickie questions here. Okay. That maybe we can tackle before we log off because they're related to the stuff I know we looked up before we started. So here's one from Karen who wants to know, is there any advantage or disadvantage to mixing mRNA vaccines for that second booster? Pfizer for the first 3 and worse side effects each time. So wondering if Moderna would give you better coverage. Do you have an opinion on this, Chana? I have an opinion.
I'm a quad. I'm all about mixing and matching. So I got AstraZeneca first, just because it was the first available. And then for my second shot, at that point, it was starting to be clear that mRNA was a safer choice and possibly a more effective choice. So I got Moderna second. That wasn't a choice. But then for my booster, I actually chose to get Pfizer just out of figuring to like cover your bases, tickle it in different ways,
Yeah.
mindset with early encouraging data.
Yeah. And a lot of the people who do, microbiology and virologists and have said that they feel like it might be slightly better to mix up your different doses. Moderna boosters and Pfizer boosters are also different dose volumes, and so if you've got worse side effects each time with Pfizer, you might see something different with Moderna. It's a little hard to predict, but it is a different dose. So
yeah. So I don't think we have like a study to point to, but it seems like that's the instinct of people in the field.
Yeah. And I do think there is some really clear evidence for people who got J&J or AstraZeneca first.
Yeah.
It is better to get a mRNA booster for those. There's some real clear evidence of that. And then we've got a couple here questions in the chat about vaccines and variant-specific vaccines, which I can answer. Are the UK vaccines updated to protect against Omicron? No, as far as I know, there is no vaccine on the market that's updated to protect against a specific variant at this point. But I will say there is also no evidence that it's really needed so far. The vaccines we have are still protecting really very well against hospitalization and death, which is what they were designed to do. And so, no, not yet. I know all the companies are working on this, and it is likely to come along at some point in the future. But I also don't think that there's good evidence that it matters so far. So, that's
I
quick
think
answer to
the
that
thing
one.
is we saw such good protection against infection early on, a symptomatic disease, that it's hard to let go of that as the goal, even though it wasn't truly the goal.
Yes. And, I think that's a higher bar as the variants get more contagious. So with Omicron, it's actually a lot harder to protect against symptomatic disease because it is more contagious. All right. And then here's one more for you, Chana. How worried about new variant when traveling?
Well, it depends a lot on your situation. So if you have fresh hybrid immunity and you've already had Omicron and you've had vaccines, I just took a trip over spring break and I didn't really worry much at all. I think it's very unlikely to get reinfected a short time after you had a similar variant.
Yeah.
If you haven't had it, then I would definitely be worried about you traveling because you just don't know this with the level of exposure, and it's just hard to control the whole situation as much when you're traveling.
Yeah, agreed. All right. Those are all the ones I saw that were related to what we're talking about.
All right. Well, thank you all for joining us today. If you want more from Dear Pandemic, you can check out their website or dearpandemic.org.
It's .org, but I think .com redirects there.
Okay. And we're also, at Dear Pandemic on various social platforms, wherever you found us today, as well as Twitter, LinkedIn, Instagram, Facebook. We're everywhere. And I highly recommend checking out our newsletter because then it comes to you and you don't have to seek it out. So if you go to the website, you can sign up for the newsletter. And if I may plug myself, I'm at Fueled by Science. You can find me on social at Fueled by Science on pretty much all the same platforms.
Great. Well, thanks very much. And thanks for taking over the Q&As, Chana.
Yeah. And if you have a question for us, please send it to us. We do read all your questions. We don't answer everyone one at a time, but we read them all and they shape our daily posts and they shape our Q&As. So keep them coming. Stay safe and stay sane.